Welcome to the Emergency Care Series presented by Apollo Hospitals, where we are discussing common medical emergencies and how to deal with them. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. Today, we are going to learn about a very, very important life-saving technique that can increase considerably your chances of survival after a cardiac arrest. It is CPR, or Cardiopulmonary Resuscitation. It's an emergency life-saving procedure performed when the heart stops beating. It is useful in many emergencies like heart attack or near drowning, or in any condition where someone's breathing or heartbeat has stopped. This is a not to be missed session, and I am really delighted to welcome Dr. Imron Subhan, who will be explaining all about this life-saving technique of CPR to us today. Dr. Imron Subhan is the head of emergency medicine department at the Apollo Hospitals in Jubilee Hills, Hyderabad. And he has more than 12 years of experience in core emergency medicine, including clinical care, EMS, disaster management, resuscitation, resident training, research, simulation, and administration. He's currently an examiner for both the membership of Royal College of Emergency Medicine and the Diploma in Emergency Medicine examinations. Dr. Imron Subhan is the immediate past president of the Society for Emergency Medicine India. He's also served on the governing board of SEMI for the last 8 years as in various positions. And he's the chairman of the WHO Task Force for the Implementation of Emergency and Trauma Care Systems, senior instructor for basic life support, advanced cardiac life support training courses under the American Heart Association. Welcome, Doctor, to our Facebook Live session today. And we look forward to hearing from you and learning the technique of CPR. So first, let's begin by talking about what does it really mean? What does it stand for?
Yeah, thank you, Dr. Shrindari, for that introduction. CPR stands for Cardiopulmonary Resuscitation, which is cardiac, which is the heart. Pulmonary is the lungs. So heart and lung resuscitation. Resuscitation is recovery. That's to put it simply. So CPR is known as cardiopulmonary resuscitation. And this is one of the important skills which must be known to everyone. It is known to all the doctors. It is known to all the nurses. It is known to all the ambulance paramedics. Anyone in healthcare facility, whoever is working in hospitals, they will already know how to do CPR. And CPR is a very important skill which must be learned by every single individual. Every citizen must know, every member of the family must know how to do CPR. Yeah, so this is one of the important skills.
So in what, why is it done? What does it exactly do in saving somebody's life?
Yeah, see, many people develop something known as cardiac arrest, where their heart stops beating. Cardiac arrest will always lead to death of a person. Now, we can prevent that from happening by performing CPR. People develop cardiac arrest all the time. You can have accident victims who develop cardiac arrest. You can have heart attack victims who develop cardiac arrest. You can have an electric shock at home and develop cardiac arrest. You can accidentally consume a poison and develop cardiac arrest. Many people with lifestyle diseases like diabetes, hypertension, other lung problems, cancers, anyone can develop cardiac arrest. And the difference between saving the life of that person who's not in the hospital depends on somebody being there who knows how to do CPR. So CPR is a temporary attempt to restart the heart. Many of the time it is successful and you will be able to save a life.
So how do we always know, like, what is the point in which, I mean, we come to the how it is done at the end of the program, but how does somebody know when to start CPR?
See, CPR must always be done whenever a person develops cardiac arrest. Now, if a person's heart stops or they develop cardiac arrest, what happens is they lose consciousness immediately. So they'll become completely unconscious. And when you observe them, they will not be breathing. So there will be no response. When you try to wake them up, how are you? There'll not be any response. And when you look at them closely, they'll not be breathing. So there will be no chest movement which will be happening. You will not be able to hear any sound, breath sound, and they would have just stopped breathing. And if you are able to check their pulse, if you know how to check their pulse, you will see that there is no pulse. So this is signs of a cardiac arrest, where a person has just become unconscious, is not breathing, and not responsive. This is the point when cardiopulmonary resuscitation must be started. So we do it in hospitals when our patients develop cardiac arrest. And if you see somebody in the park or in the gym or near the swimming pool who develops cardiac arrest, you should be able to start CPR immediately.
I think maybe it's a good idea to demonstrate this CPR now, and then we will go on to the other questions about the types of CPR. Maybe, what do you think, doctor? Do you think it's better
Okay.
to show the
Uh,
basic technique first?
Yeah, definitely. This is our training facility. I'm inside a training hall. So I will tell you the steps of the CPR. I'll just show it to you. So the
Yes.
first thing what you have to do, I'm just outlining in a few seconds how you're supposed to do the CPR. So whenever you have somebody who has fallen down, who's become unconscious, the first step is known as shake and shout. So just shake and shout and see if the person is responding. If he is not responding, then immediately you will have to call for help. Calling for help is either an emergency number like 1066 for Apollo hospitals, or if you're close by to any other hospital, you should be able to call for help. So immediately after calling for help, you have to start the chest compressions. So you keep your hand in between on the center of the chest and begin the chest compressions. You have to do 30 compressions. After that, you have to give 2 rescue breaths in the mouth. So I'll be demonstrating that. So again, I'm repeating. The first step is to shake and shout. The second step is to call for help. And the third step is to begin the chest compressions immediately. After 30 compressions, you do 2 rescue breaths. So I'll pull a table behind me and I will show you how it is done.
Yes.
So this is a mannequin. Dr. Srinidhi, you can hear me, correct?
Yes, I can. I can.
Yeah. So this is, let's assume that this is a patient or a person who has become suddenly unresponsive. So whenever suddenly they become unresponsive, the first step is to shake and shout. Hello, sir, are you okay? Are you okay? So be a little loud, scream in the ear and shout, are you okay? Are you okay? So you should be able to see some sort of a movement if the patient is not having cardiac arrest. Someone who has become just unconscious because of low blood sugar will still be breathing and he will respond. But a person in cardiac arrest will not be responding. Hello, are you okay? Are you okay? So the moment you recognize that the person is not responding, is not breathing, is unresponsive, the next immediate step is to call for help. Take your phone immediately and dial 1066 and tell them that there is a cardiac arrest here in this location. Give them the address and tell the ambulance how to reach you and tell your callback number immediately. So this is known as calling for help. Alternately, you can tell somebody, hey, there is a cardiac arrest victim. Please call somebody for help and call an ambulance and bring the defibrillator if it is available. Tell somebody so that they call for help. Immediately after that, you can begin chest compression. So remember that chest compression is always in the center of the chest. So you have to keep on the sternum. There is a bone here, very hard bone. So right in the center of the chest, you have to press. So keep both your hands, keep here, keep the second hand here, go above the patient and begin your chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once 30 breaths are completed, you have to give 2 rescue breaths to the person. So rescue breaths is whenever you are at home, you can give mouth to mouth breathing. So you have to do the head tilt chin lift. Observe what I'm doing. So you are tilting, you're doing something known as head tilt chin lift. Close the nostrils tightly. So you have to close the nostrils tightly and then seal your lips and give 2 rescue breaths. Take a deep breath, and you blow out a breath. So observe now, I'll give 2 rescue breaths. So I'm doing the head tilt chin lift maneuver. I'm sealing the nostrils tightly and then I'm giving a 2 rescue breaths. 1 rescue breath given, take a deep breath. 2nd rescue breath given. After 2 rescue breaths, again begin chest compression. 1, 2, 3, 4, 5. This is how you have to do. So you have to do 30 compressions, 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. You have to continuously do until an ambulance comes and or you are able to take the patient to the hospital. So this is the process of doing a chest compression.
So, doctor, how do you? Is there any way to tell whether is there some sign that a person will respond, or we just have to keep doing it till he's taken to the hospital?
CPR most of the time will result in restart of the heart. So when the heart restarts, immediately the patient may start gasping. So they may take a breath. So you'll know that there is signs of life which has come. They'll start breathing, or they may start moving like that. That means your CPR has been successful. So a restarting of the breathing is an indication that the CPR has been successful. If you have been trained properly in a CPR course, you will be able to measure you will be able to check the pulse. So I'm not teaching the pulse because you need to be thoroughly taught in a training course for checking for pulse. The pulse is one of the best ways to detect that a heart has restarted.
Yes. Is there also a kind of a minimum time frame within which it is done and the patient has a better chance of surviving?
Yes. CPR is most effective when it is started immediately. To be very specific, you need to restart CPR within 4 minutes of cardiac arrest. Now, why is it 4 to 6 minutes? It's because the cells of the brain, once they die, they will not recover. And the cells of the brain need continuously to receive oxygen. So if you have cardiac arrest, if a person develops cardiac arrest and no blood flow goes to his or her brain, then the brain cells will start dying. And you have exactly about 4 to 6 minutes to reverse that. So if you start the CPR within 4 to 6 minutes, that's the best chance of survival. Every minute you delay will result in more and more cells dying, and your chances of recovery are lower. So in fact, after about 10 to 12 minutes, there is absolutely no chance that you will be able to bring this patient back alive.
Is this done the same way in both adults and children?
It is similar, but there are differences. In an adult, you saw me demonstrate, I was using both the hands to press. Somebody who's a teenager or a small boy or a girl, you can just use one hand. Just keep one hand and you can press because their chests are smaller. When there is an infant who's just 1 year old, very small baby, then you may have to do with a thumb or with finger like this, pressing with a hand. So all this you'll be able to learn whenever you are able to attend a CPR training program.
There is this, in an emergency, people sometimes feel that, oh, we don't know how to do this properly. So, is it going to cause more harm if I try to attempt it? So how true is that belief?
What I would say is that, see, a person who's in cardiac arrest is going to die if nothing is done. So whatever you do, even if it is not completely correct, you will be able to save the life of a patient. So even if you are not able to do CPR properly, but you have done a little bit, it gives that small 1%, 2% chance of that patient to survive. If you don't do anything, just being scared, then the patient will never live and the patient will die. So it's always important that go ahead and try to save the life. At least watch some videos on how CPR is done, or attend a training program which may be done close to you so that you know how to do CPR. That's the best chance a person will get whenever that person is in cardiac arrest. So you should not fear. You should go ahead and attempt the CPR.
Are there different types of CPR?
I would not say different types. There are different stages of CPR. The first is known as basic life support, which is what you and me would do in a outside the hospital scenario. If you are in a mall or a supermarket, somebody develops cardiac arrest. What we do CPR there is called as basic life support, where we do chest compressions, we give them breaths, and we try to switch roles between 2 or 3 people and try to continue the CPR. We may be able to give electric shock if it is available. Today, there are airports, there are some malls and other places where you have these defibrillators which can give a shock. So you may be able to give that. This forms basic life support. When the patient is brought into a hospital or an ambulance team reaches the patient, this is known as advanced cardiac life support. In advanced cardiac life support, we'll be able to attach the monitor, we'll be able to see what is the rhythm of the heart, decide to give a shock. We'll give them drugs like adrenaline in order to restart the heart. We will give oxygen to them. We will put a tube into their throat so that the lungs are expanding, and we'll take full control of the CPR. This is known as advanced cardiac life support. So it's actually 2 stages: basic life support and advanced cardiac life support.
Is there also something where only the hands are used and there is no breath given? Is there something like that?
Yes, yes. See, in people who are not familiar with how to do CPR, or if they find it difficult to give the breaths, then we encourage that they do just hands only CPR. Just put your hand on the chest and just start pressing. So just count 1, 2, 3, 4, and just do that. You can forget about the breaths. This still saves lives, and there are patients who have restarted their heart just with hands only CPR. So yes, it is recommended. If you don't know how to do the breaths which are supposed to be given, you can just do the hands only CPR.
If you were saying that a sign that a person's heart might have restarted is when they start gasping or when you
Yes.
can feel pulse. So at that point also, should we continue to do the CPR, or should we just or by the time help should have arrived, or how does it work? Like, do you have to keep doing?
Yeah, when a patient starts gasping or he shows signs of life, it means your CPR has been successful. So, but you have to always watch them closely. Even though you have stopped your CPR, you can stop your CPR at that point in time, but you have to watch them because they can again go into cardiac arrest. And many of these patients, their breaths would not be sufficient, or they may have something like a saliva or vomit which is coming out. So you just need to turn them to their side. So just turn them across their side, tilt them to the side so that if there's any vomitus and all, it will come down. So you have to take care of them very carefully. Hopefully by this time, you should have an ambulance team, hopefully a paramedic or a doctor who has come there to take care, and they can take better care of the patient. But the important thing is you have been successful in doing your CPR.
Also, are there any pitfalls to doing? I mean, we already said that people should not be scared, and whatever they know, they should attempt it. But
Yeah.
have there been instances of like perhaps too much force, or something going wrong with, or is any possibility that there is some damage caused by doing some kind of very uh, like too forceful CPR or anything like that, or is saving the life more important there?
Yeah, I would repeat what you told your last sentence. Saving the life is more important. people are scared because they may feel that they may press too hard and you can injure the organs, you can injure the heart, or the ribs, the bones which are there, they can fracture. So all that is of not a concern, because in a patient whose heart has stopped and death is inevitable, you have to do everything possible in order to restart the heart. And in many patients, you can hear the ribs breaking. For example, somebody who's very old, someone who's like 70, 80, or 90 years, they have very thin bones. So when you press on their chest, you can hear the ribs crack. But it's not a problem because you are trying to restart their heart. Rib fractures will heal, but
Yeah.
a stopped heart, you have to restart. If you don't do that, then the patient will die. So again, I'm reassuring that you should not be scared that you may press too hard. Just go and start the CPR. You will be able to save the life of a patient. So again, it's important to attend the training programs, because if you attend training programs, you'll at least you'll get to feel how deep you are supposed to press and how it actually feels to press a chest of a real patient.
So, is there anything else that you would like to say about this or any related topics before we wind up the session?
Yeah, I would encourage that in every family, at least one person must know CPR. Any person who's above fifth standard can learn CPR. So it's very strongly encouraged that within each family, everyone knows CPR so that they can save life whenever it is necessary. Many people die because it takes a long time for them to reach a hospital, and the difference between life and death is someone performing this CPR. So we have seen so many instances where people have drowned in the swimming pool, people have collapsed during sports, in the gym, in the football field. We had people who had collapsed in the malls, while traveling in the airports, in the bus stations. All these people can be saved whenever you perform CPR. So even if there are people who are not doctors, just do the CPR for a few minutes. You'll buy that precious time for that ambulance to reach and a doctor to attend to the patient. So I strongly encourage that wherever you are, try to find a CPR course wherever it is and attend that course. You will never regret that, and you will always remember it for several years on how to do CPR. So that's what I would strongly encourage.
So, viewers, I hope that the message here has been clear that learn how to do CPR, and also if you're unsure and somebody needs it, it's always better to do it rather than to do nothing at all, because that would be the difference between someone's life and death. Thank you so much, Doctor, for this very wonderful and illuminating discussion. And please, viewers, know that our emergency services are also always available to assist you through any emergency. So do not hesitate at any time to call us, and hope to see you all soon again. Meanwhile, take care, be safe, and be healthy.